Patrick was just saying something very interesting to me, which was that there really should not be much of any transection with FUE these days. And that kind of shocked me because, transection is still something that I hear around a lot about transection rates. So what are your thoughts, and why am I still going to the gym on a regular basis and seeing guys with like this moth-eaten, back of their heads and not a lot of hair on the top of their heads? Why are we seeing this?
I will say what we're observing today, in terms of bad FUE, because remember at the beginning, if we just move from FUT to FUE was to avoid scars.
Mm,
That was the thing I said, we will do a surgery where it won't be noticeable. But how can we make it not noticeable? So there is something like you have to follow, some basic rules on wound healing that makes the hair looks good. But today, as I was telling you, there's one first thing. At the beginning, we were dealing a lot with what we call transection. Transection was like you damage your follicle when you're extracting because you use sharp punch and you destroy the follicle. And at that time, you will not have enough hair to put on top. So the guy will not have enough because you transected. But today, it's not even though that we see a lot. We see like a lot of people like where the donor is depleted. And then you look on top, you see nothing.
Yeah.
But that is just due to people extracting the bad way.
Okay.
So they take too much hair at the same times, and it's not only transection, but you have transection, dryness of the hair, like the blood supply, that it's so much that there is a conflict.
Okay.
And that makes like the hair doesn't grow properly. And at the end of the day, you destroy the donor area and you don't have enough for the top. But the key factor, and I will say today, the big problem we're having in the industry is a lot of non-physician doing the surgery. Because they thought like, oh, FUE is not invasive, there's no risk, so everybody can really punch and get the graft.
Yeah.
So the basic of what I was saying, the wound healing, the geometry of everything becomes like nobody follow that, because some of them doesn't have just the background to understand how a wound heals. They're non-physician. How do I know the distance between two wounds for that not to create a scars? Those are the basic where I'm kind of, now we have to focus on training physician, because the doctor, the physician, doesn't get well trained. And most of them, because maybe for the sake of being like lazy or finding the easy way, they're trying to delegate all the hair transplant to the technician without even though training the technician, because you can do that, but then get the time to train people for them to understand how a wound heal. And so that's why, like for me, we have to go back to the basic on training the doctors. Now, if the doctors train his technician and the technician does the surgery under his supervision, okay, so be it. For me, as far as we have good donor management, good recipient management, you will have a great surgery. But physicians today are the guy that has to be trained. And we don't have enough training program, serious training program, where the physician will go through all the training process. Most of the time they go to the workshop, they go to the conference, and we all know that when you go to the conference, it's 3 days, you spend 1 day in the conference and 2 days in the bar.
Okay.
Drinking, networking, things like that. So because you have been working the entire year at your office, so you don't want to go to the conference and then work like crazy. You just want to relax. But you networking, you learn new things. So that's not a really good set to be, because this is serious matter. We have life of patient in our hand. So when you train, you have to be focused. You have to put all your energy. And it's not during a conference in the Bahamas that you do that. So for me, we have to make sure like the physicians are well trained. And well trained means like you have a coach, you have to spend your time in a good environment where you learn, and you learn all the basics. And at the end, you can get that knowledge and, delegate that to your technician, to your team, because for me, hair transplant is a teamwork. The physician is there, but your technician has to read your mind. And that's why, like, if you work longer with your technician, you don't, even though didn't tell them what to do, they know. So that's why, like, they feel like they can do the surgery. So that's why, like, today you have many technicians who kind of take the punch and start to do, because they've been working with those physicians, so they kind of read their mind. They say, so I know. But the trick part is always, like what I say, when it comes to wound healing, some complications, some patients, like we were talking about the necrosis, those are the things. If you don't have the medical background, maybe you can miss it. But at the end of the day, training is the key. That's what, like, I was telling, like, today, I will say, we are at the point with FUE, especially with the hybrid punch, the U-graft, the WOW, the Trivellini. You hear all these names. I can tell you, I think that's the revolution in FUE, because those punch, I'm insisting, punch, if you let them work properly, you don't transect. So the only thing the physician has to do is to now follow the basic of how many percentage do I have to take? What should I not do? And all the rest, the grafts and everything by itself, we have the technology out there to really perform a surgery, a FUE, with no mess at all.
Wow. And so still, though, how long would you suggest that someone is training for, before you would say that they're pretty good at really extracting?
I will say minimum a full year.
Minimum of a full year.
Minimum of a full year. Sometimes it goes to 2 years, but minimum of full year, because most of the time I observe there's some people who are talented that can learn very fast, but I observe, like, from everybody I observe, usually the first 4-5 months, they start to grasp the concept.
Okay.
So now they have to see difficulty, like different case. How do you change the angle? Because sometimes, there's a principal rules, like in hair transplant, say, you have to be parallel to the existing hair. So you create that same density. But in some patient, you can be there, I have few graft. But how can I create more volume if I follow his natural hair? Because his natural hair makes it look thin. So you have to go around and change the hair direction and create something that is not natural on him, but that will help him to have a full coverage. But those things, you have to be around somebody who has that feeling.
Yeah, it takes a while to come across the difficult
moments
that make you grow, basically.
And those things, you have to be around someone who will teach you. But the basic, you need to be there. And I would say, for me, the basic thing, you have to learn to punch. Punching with the new device, understanding the donor management, you need at least 3 months. So it means, like, 3 passes where you work for 3 months, then you start to master that concept. Then there's the placement, the recipient. You need 3 months to start understanding how do I place, even though if I use the tray implanter, like today you will see a lot of people doesn't use the forceps because it's very difficult to use the forceps to place, so they like the implanter. But even though with the implanter, you have to understand the angulation for the graft to look natural, because lately I'm doing a lot of repair. It's what? I'm removing not the plug like we were removing before, but the graft that are wrong place. You have people who place the graft like this, because with the tray implanter, they cannot angle properly.
Oh, so this is using the implanter pin.
The implanter.
And they're angling it the wrong way.
The wrong way.
And supposedly the implanter pin fixes everything and makes it easy, right?
But it's horrible, because, like, today I'm kind of, even though in my schedule, usually I put, before we were putting plug removal. So now I say, no, it's not plug removal, it's graft removal.
Wow.
Because they're putting FUE graft, but just in the wrong way. So the patient is not happy. So you have to remove them.
Oh, man.
And that's to grasp the concept of good placing, how to follow up, as we were talking about, the soft hair, following by the two hair, following by the fullness of the hair. Those concepts, you need at least 4 months again to master that. So you have 3 months to master your donor management. You need 3 to 4 months to manage.
And this is like doing hair transplant basically like 5 days a week.
5 days a week.
Yeah.
5 days a week. Then you have like 6, 7 months, you start to feel like, now I know. So now they have to let you dig by yourself. So you need those 3, 4 months again where you feel like I'm doing with nobody telling me, and then they have to come and look at if I did right.
Yeah.
So you need like a full year, 5 days a week. But now if you do like 2 days a week, then you need like a 2, 3 years to get
It's
there.
funny because nobody wants to be the patient who's getting trained on.
Yeah.
I mean, really, in order
but
to do
but
this.
but in order to do that, that's why like if you don't want to be that's why like I always tell physician, if you don't want to get trained on somebody, you have to be a part of the team.
Yeah.
Because when you're a part of the team and working on a daily basis, like in our clinic we work 5 days, 6 days a week, of course you'll be part of the team. You will never be doing wrong stuff because you will always have somebody around you that tells you how to do. Then progressively we'll let you work as we see your progression.
Yeah, I noticed that in the last time you did surgery with my beard, the guy who was there, I think his name was Steven, is that right? Yeah. And, he was obviously training underneath you, for that. So I think that's really cool. Like, I feel like more of like the top surgeons should have people underneath them training, all the time. Yeah.
Because we need to train. We need to train a lot of it. Because at the end of the day, there's so many patients that will need help and they cannot come all to the same clinic.
Yeah.
Like I'm booked for 3, 4 months, but if someone wants, where should he go? So we need to get to train people. And I think physician wants to come to this field, they have to commit themselves. Yeah. Because I think that's the problem. Today, I don't know if it's monetary problem. People feel like, oh, I want to do hair transplant surgery, but I just want to make also my money. So I keep my practice. Then I will do hair transplant one day. You don't learn that way. It's just like, it will take you forever and you will make a lot of mistakes. So if you want to train, just focus, dedicate 1 full year where you can spend maybe 2 weeks per month consistently training yourself. Then you will see like you will learn fast and then you can really fly by yourself. Otherwise, you will be just the bad physician and this is bad for the patient.
Yeah. Thanks so much for watching, guys. I hope you enjoyed this video and we'll see you soon.